Hello students, welcome to Module 2 in your Advanced Health Assessment course. I'm Dr. Williamson, and in this section of the course, what you're going to be looking at is an overview of the head-to-toe exam, examination techniques, clinical judgment, and recording. And so in this module, you're going to be building on what you did for last in Module 1, and so you're going to take some of the information that you collected from your history and your review of systems, and you're going to apply it to this assignment as well. You'll see your student learning outcomes are listed here for you. You see your student learning activities and learning experiences, what areas in your Bates text you should be referring to and reading, and then in your Collins text as well, which is your differential diagnosis textbook that you have. You've also got some resources to enhance learning, and I'm not sure if I mentioned this in the overview for Module 1, but you always have Cocky's Cliff Notes that are in these sections in your resources to enhance learning here, and so be sure that you're reviewing those as well. They'll not only help you with test questions, but they'll help you understand what you're doing for these assignments and what you need to be focusing in on as well. So the content from this section will be on your Module 1 quiz, and your quiz 1, which is from content from modules 1, 2, and 3, and will also be on your comprehensive final exam. So when we're looking at your assignment for this module, what you're going to look at is you've got a differential diagnosis worksheet, and on the worksheet this has got on the first page of it, it's got some examples of how you're going to work through and make a differential diagnosis, and it tells you that you identify abnormal findings, you're going to localize your findings anatomically, interpret the findings in terms of a probable process, you're going to make a hypothesis about the nature of the patient's project, and then test that hypothesis to establish a working diagnosis, and then develop a plan for your patient. So on the first page, it gives you an example, and first it kind of gives you a scenario, and then it lists out for you some problems that they've identified as your example for this patient of what some of the problems are for this patient, and then there are potential differential diagnoses that they've developed. So for each one of those problems that they've listed, then they have included a potential differential diagnosis on that. And so all throughout the worksheet there's several pages, and what you'll see is you've got 3 pages, 1 through 10, that gives you a case, it gives you a problem list to list out, and potential differential diagnosis list. So work through this. This worksheet is not for grading. You will receive points for showing your work on it and submitting it. So even if you want to write on it and write out your information on it as you worked through it, and scan it in and submit it, that'll be fine too. So as long as you show me that you've worked through this worksheet, that'll be fine for your submission for that. So your assignment for this section here is the second attachment here, where you see it here. This is going to be completing a differential diagnosis worksheet from your health history and review of systems assignment. So what you're going to do is you're going to follow the examples which have been provided for you in your worksheet. In your first one, you're going to look at your reading from your Collins book and from your Bates book. You're going to work through that differential diagnosis worksheet for practice. And then what you're going to do is you're going to develop a problem list from the patient's information you collected from the health history and review of systems assignment. Some examples of problems that your patient might have would be things like elevated blood pressure, being overweight, tobacco use, low back pain, respiratory problems, GI problems, something like that. You can also follow the guidelines from your Bates and Collins text. You're going to identify abnormal findings which led you to identify this problem from your health history. Then you're going to number the problems according to the priority based on your findings and just your clinical reasoning that you've used. You need to have a minimum of 3 problems. So see that example on your differential diagnosis worksheet where they list problems for you there for the format. And then based on your clinical reasoning skills and the identified problems, you're going to produce potential differential diagnosis for each of the patient's problems. So for each problem you identify, you're going to develop a potential differential diagnosis for each one of those. You can also use your Collins and Bates text to help you with this because it has symptoms or problems matched with differential diagnosis. It especially has this in your Collins text. Then you want to include supporting data and rationale for your choices. That you have picked. Both subjective and objective data would be good to include there. And then again, put it in the format that's on the worksheet. You won't have access to lab work or other diagnosis exam results from your patient, but what could or should be ordered for your potential differential diagnosis. And you'll also see in your Collins text, it has approach to diagnosis or other useful text. Use that as a reference so you can include that information in there as well. You're going to submit the problem list, create a Word document, put this patient's information on there, submit the problem list and your potential differential diagnosis and the supporting data to your provided submission link for this assignment. Be sure you use the format from the example on the differential diagnosis worksheet and show on the differential diagnosis worksheet also, you're going to submit that as well. So you're going to show your work on that. Be sure you refer to the course calendar for the due date. And then look at the grading rubric, which is at the bottom of that assignment sheet, so you'll understand exactly what you have to include in that and to avoid point loss. So I hope you'll enjoy this assignment and good luck. Let me know if you have any questions or concerns regarding this assignment.